Hello everyone. Welcome back to the channel. Today we're talking about something that affects millions of people worldwide, yet most don't even know they have it. If you've been feeling unusually tired even after a full night's sleep, if you're experiencing tingling sensations in your hands and feet that you can't explain, or if you've noticed your memory isn't what it used to be, you need to pay attention to what I'm about to share. These symptoms might seem unrelated, like they're just part of getting older or dealing with stress, but they could all point to the same hidden problem, a deficiency that develops so slowly you don't notice it happening until serious damage is already done. This particular deficiency affects your brain, your nerves, your blood cells, and even your DNA. Yet blood tests often miss it in the early stages when treatment would be most effective. What makes this especially concerning is that by the time most people finally get diagnosed, they've already been living with declining health for years, dismissing symptoms as normal aging when their body has been crying out for help. Some people lose the ability to walk properly, others develop permanent nerve damage, and a significant number experience cognitive decline that looks exactly like early dementia, but isn't. It's completely reversible if caught in time. We're talking about vitamin B12. Vitamin B12, also called cobalamin, is one of the most critical nutrients your body needs to function properly. This water-soluble vitamin plays essential roles in creating red blood cells, maintaining your nervous system, producing DNA in every cell of your body, and supporting brain function. Your body can't make vitamin B12 on its own, which means you must get it from your diet or supplements. What's fascinating about B12 is that your liver stores enough to last several years, typically between 2,000 and 5,000 micrograms, which is why deficiency symptoms can take a very long time to appear. Adults need approximately 2.4 micrograms daily. Pregnant women need 2.6 micrograms. And lactating women require 2.8 micrograms. People over 65 often need higher amounts because absorption decreases with age. Research shows that between 3 and 43% of older adults have some level of B12 deficiency, making this a serious public health concern that doesn't get nearly enough attention. The benefits of adequate vitamin B12 levels are profound and affect virtually every system in your body. First, B12 is absolutely essential for red blood cell formation. Without sufficient B12, your body produces abnormally large, immature red blood cells called megaloblasts that can't function properly, leading to megaloblastic anemia. This type of anemia causes severe fatigue, weakness, pale skin, and heart palpitations because your tissues aren't getting enough oxygen. Second, vitamin B12 is crucial for maintaining the protective myelin sheath that covers your nerves, similar to insulation on electrical wiring. This sheath allows electrical impulses to travel quickly and efficiently through your nervous system. Without adequate B12, this myelin breaks down, causing peripheral neuropathy with symptoms like numbness, tingling, burning sensations in your hands and feet, and eventually loss of coordination and difficulty walking. Third, B12 supports proper brain function and helps prevent cognitive decline. Studies indicate that people with low B12 levels experience memory problems, confusion, difficulty concentrating, and mood changes including depression and anxiety. Some research suggests that maintaining adequate B12 levels throughout life may help protect against dementia, although the evidence is still being evaluated. Fourth, vitamin B12 works together with folate and vitamin B6 to control blood levels of homocysteine, an amino acid that at elevated levels has been linked to cardiovascular disease risk. By helping to regulate homocysteine, B12 may play a role in protecting heart health. Fifth, B12 is essential for DNA synthesis, the process your body uses to create genetic material for new cells. This makes B12 absolutely critical during periods of rapid cell growth, particularly during pregnancy and infancy. Pregnant women with inadequate B12 levels face increased risks of miscarriage, preterm birth, and low birth weight babies. Their infants may also develop B12 deficiency, leading to failure to thrive, developmental delays, and potential permanent neurological damage if not corrected quickly. The symptoms of vitamin B12 deficiency develop gradually and can be easily mistaken for other conditions or simply ignored as normal aging. Early symptoms include persistent fatigue that doesn't improve with rest, weakness, lightheadedness, pale or yellowish skin, shortness of breath, and heart palpitations, all signs that your body isn't producing enough healthy red blood cells. Neurological symptoms often appear next and can become permanent if deficiency continues. These include numbness or tingling in your hands and feet, balance problems, difficulty walking, muscle weakness, vision problems, and cognitive changes like memory loss, confusion, difficulty concentrating, and mood changes, including depression and irritability. In severe cases, people may experience glossitis, where the tongue becomes smooth, red, and painful, digestive issues, including nausea and loss of appetite, and in infants, developmental delays and failure to thrive. What makes B12 deficiency particularly dangerous is that neurological damage can occur even before anemia develops, and if the deficiency continues for too long, some nerve damage becomes irreversible despite treatment. Several groups of people face elevated risk for vitamin B12 deficiency and should monitor their levels carefully. Older adults top this list because the stomach produces less hydrochloric acid as we age, and this acid is essential for releasing B12 from the protein it's bound to in food. Studies show that 10 to 30% of adults over 50 have difficulty absorbing B12 from food. People with pernicious anemia have an autoimmune condition where their immune system attacks the stomach cells that produce intrinsic factor, a protein absolutely necessary for B12 absorption. Without intrinsic factor, virtually no B12 gets absorbed from food, making lifelong supplementation mandatory. Individuals with gastrointestinal disorders, including Crohn's disease, celiac disease, and bacterial overgrowth in the small intestine, often struggle to absorb B12 properly. Those who have had gastrointestinal surgery, particularly procedures that remove part of the stomach or small intestine where B12 absorption occurs, also face permanent absorption difficulties. Vegetarians, and especially vegans, are at high risk because B12 is found naturally only in animal products. Studies indicate that 40 to 80% of vegetarians and vegans who don't supplement or eat fortified foods develop B12 deficiency. In India and Hong Kong, approximately 80% of the vegan population shows B12 deficiency. People taking certain medications face increased deficiency risk as well. Proton pump inhibitors and H2 blockers, commonly used for acid reflux and ulcers, reduce stomach acid production and significantly impair B12 absorption when taken long-term, particularly for more than 12 months. Metformin, the first-line medication for type 2 diabetes, can reduce B12 absorption by up to 22% of users when taken for more than 4 months. Talk to your doctor about B12 monitoring if you take these medications regularly. Now let's discuss the best food sources of vitamin B12. Animal products contain the richest concentrations. Beef liver stands out dramatically, with just 3 ounces providing approximately 70 micrograms, which equals nearly 3,000% of your daily needs. Other organ meats like kidney also contain extremely high amounts. Clams are exceptional, with 3 ounces of cooked clams delivering about 84 micrograms, or 3,500% of the daily value. Fish including salmon, trout, tuna, and sardines provide excellent B12, with a 3-ounce serving of salmon containing approximately 2.4 to 4.8 micrograms. Red meat, particularly beef, supplies substantial B12, with a 3-ounce serving providing around 1.5 micrograms. Poultry like chicken and turkey contains moderate amounts, with 3 ounces supplying approximately 0.3 micrograms. Dairy products contribute significantly to B12 intake in many diets. 1 cup of milk provides about 1.2 micrograms. 1 cup of yogurt contains approximately 1.1 micrograms, and cheese varies by type, with Swiss cheese providing about 0.9 micrograms per ounce. Eggs contain B12 concentrated in the yolk, with 1 large egg providing approximately 0.6 micrograms, or 25% of daily needs. However, the bioavailability from eggs is relatively low at less than 9%, compared to 40 to 60% from fish, poultry, and meat. For those following plant-based diets, fortified foods become essential. Many breakfast cereals are fortified with B12, providing 0.6 to 6 micrograms per serving depending on the brand. Nutritional yeast is often fortified and can provide significant B12, though amounts vary by product and you must check labels carefully. Fortified plant-based milks, including soy, almond, and oat varieties, typically contain 0.6 to 3 micrograms per cup. Some meat alternatives and plant-based proteins are fortified with B12, but again, you need to verify this on product labels. The recommended daily dosages vary based on your situation. For adults under 65 with no absorption issues, the standard recommendation is 2.4 micrograms daily from food sources. Adults over 50, and especially those over 65, should aim for higher intakes because absorption decreases with age, with many experts recommending 25 to 100 micrograms daily from supplements or fortified foods to ensure adequate absorption. Pregnant women need 2.6 micrograms daily, and lactating women require 2.8 micrograms daily to support both their needs and their baby's development. Vegetarians and vegans must supplement consistently, with recommendations typically ranging from 50 to 100 micrograms daily, or 2,000 micrograms once weekly, or consuming fortified foods 3 times daily, with each serving providing at least 190% of the daily value. For treating diagnosed B12 deficiency, much higher doses are used. Oral supplementation typically involves 1,000 to 2,000 micrograms daily for several months until levels normalize. Research has demonstrated that high-dose oral B12 works just as effectively as injections for most people, even those with absorption problems, because approximately 1% of B12 is absorbed through passive diffusion regardless of intrinsic factor availability. Intramuscular injections are sometimes preferred initially for severe deficiency or serious neurological symptoms, with typical protocols involving 1,000 microgram injections given weekly for 8 weeks, then monthly for life. People with pernicious anemia require lifelong B12 supplementation, either through daily high-dose oral supplements or monthly injections. Always work with your healthcare provider to determine the appropriate dosage and form of supplementation for your specific situation. Vitamin B12 helps prevent and treat several serious medical conditions. Pernicious anemia, caused by the inability to produce intrinsic factor, results in severe B12 deficiency that leads to megaloblastic anemia and progressive neurological damage. Treatment with B12 supplementation reverses the anemia within weeks and can prevent further neurological deterioration, though existing nerve damage may be permanent if treatment is delayed. Megaloblastic anemia from any cause of B12 deficiency responds well to B12 treatment, with reticulocytosis, the production of new red blood cells, typically beginning within days, and hemoglobin levels normalizing over several weeks. Peripheral neuropathy caused by B12 deficiency can improve significantly with supplementation, though recovery depends on how long the deficiency existed before treatment started. Early treatment offers the best chance for complete recovery, while long-standing deficiency may result in permanent nerve damage. Subacute combined degeneration of the spinal cord, a serious neurological complication causing numbness, weakness, balance problems, and gait disturbances, requires immediate high-dose B12 treatment to prevent irreversible damage. Studies show that neurological improvement typically begins within the first 3 months of treatment, with continued gradual improvement possible for up to a year. Cognitive impairment and memory problems associated with B12 deficiency often improve with supplementation, though the relationship between B12 and dementia remains under investigation. Some research suggests that correcting B12 deficiency may slow cognitive decline in certain individuals, but B12 supplementation doesn't appear to prevent dementia in people with adequate B12 levels. Hyperhomocysteinemia, elevated blood levels of homocysteine, can be reduced by taking B12 along with folate and vitamin B6, potentially reducing cardiovascular risk, though studies on whether lowering homocysteine actually prevents heart attacks and strokes have shown mixed results. One of the remarkable aspects of vitamin B12 is its safety profile. Vitamin B12 has no established upper intake level because it's generally considered safe even at very high doses. Your body doesn't store excess B12 for long, instead excreting what it doesn't need through urine and feces. Multiple studies using extremely high doses, some involving daily injections of 60,000 micrograms for months, have shown no adverse effects. In Japan, researchers treated multiple sclerosis patients with 60,000 microgram daily doses for 6 months with no toxicity. Kidney dialysis patients received 5,000 microgram injections 3 times weekly for 6 months, raising their blood levels to more than 100 times normal without causing side effects. However, theoretical risks exist with excessively high doses, particularly from injections. Very rare cases of allergic reactions, including anaphylaxis, have been reported with injectable B12, particularly in people with allergies. Some individuals experience mild side effects from high-dose supplements, including headache, nausea, diarrhea, or itching. In extremely rare cases, documented in only a handful of medical reports, people who received massive doses, 12,000 to 15,000 micrograms through multiple daily injections over several weeks, developed symptoms including acne-like skin eruptions and, in one case, what appeared to be manic symptoms possibly triggered by the extremely high B12 levels. It's important to note that these cases are extraordinarily rare and involved doses far exceeding normal supplementation levels. Some research has raised questions about very high B12 blood levels being associated with increased mortality risk and possibly increased cancer risk, but these associations appear in people with elevated B12 from underlying medical conditions like liver disease or kidney disease, not from supplementation. The practical takeaway is that B12 supplementation at doses up to 2,000 micrograms daily is considered completely safe for the vast majority of people. Higher doses may be prescribed for treating deficiency under medical supervision. If you're taking B12 supplements as recommended and experiencing any concerning symptoms, discuss them with your healthcare provider. Though true B12 toxicity from oral supplementation is essentially unheard of in medical literature, here's what you need to understand about getting your B12 levels checked. If you're experiencing symptoms that might indicate deficiency, or if you're in a high-risk group, ask your doctor for B12 testing. The standard test measures serum B12 levels, with normal ranges typically considered to be 200 to 900 picograms per milliliter, though many experts argue that levels below 300 to 400 picograms per milliliter can still cause symptoms. Some people have normal or borderline B12 blood levels, but still have functional deficiency at the cellular level. For these cases, testing methylmalonic acid and homocysteine levels provides more accurate assessment, as both become elevated when B12 deficiency exists at the cellular level, even if blood B12 appears normal. If you're vegetarian, vegan, over 60, taking acid-reducing medications or metformin, have had gastrointestinal surgery, or have digestive disorders, regular B12 monitoring makes sense. For vegans and vegetarians who don't supplement, annual testing is reasonable. For those taking medications that affect absorption, discuss appropriate monitoring schedules with your healthcare provider. Remember that by the time B12 deficiency shows up in routine blood work, you may have already been deficient for years because your body draws from liver stores before blood levels drop. Early supplementation prevents the serious complications we've discussed. If you're diagnosed with B12 deficiency, taking it seriously matters immensely. Follow your treatment plan consistently, whether that's daily oral supplements or periodic injections. Don't stop treatment just because you feel better, as your body needs ongoing B12 to maintain the improvements. If your deficiency was caused by dietary insufficiency, permanently increasing B12-rich foods or maintaining supplementation is essential. If it's caused by absorption problems or pernicious anemia, lifelong supplementation isn't optional. It's mandatory to prevent recurrence and protect against irreversible neurological damage. The relationship between B12 and your health exemplifies how a single nutrient can affect multiple body systems simultaneously. Your brain needs B12 to function properly and maintain cognitive abilities. Your nerves need B12 to stay protected and transmit signals correctly. Your bone marrow needs B12 to produce healthy red blood cells that carry oxygen throughout your body. Your DNA needs B12 to replicate accurately when cells divide. When B12 levels fall, all these processes begin breaking down, though the damage accumulates so slowly that months or years pass before you connect your symptoms to a vitamin deficiency. This gradual progression makes B12 deficiency particularly insidious. Someone might dismiss increasing fatigue as getting older, attribute memory problems to stress, and explain away numbness in their feet as poor circulation or neuropathy from another cause. Meanwhile, the deficiency worsens, nerve damage accumulates, and red blood cell production becomes increasingly abnormal. By the time obvious anemia or serious neurological problems appear, significant harm may have already occurred, some of which may not fully reverse even with treatment. This is exactly why awareness matters so much, why high-risk individuals need regular screening, and why vegetarians and vegans must take supplementation seriously rather than waiting for symptoms to appear. Quick reminder about working with your healthcare provider. This information is educational and helps you understand B12's crucial role in your health. If you suspect you might be deficient, if you're in a high-risk group, or if you're experiencing any of the symptoms we've discussed, schedule an appointment with your doctor. They can order appropriate testing, determine whether you need supplementation, and recommend the right dose and form for your specific situation. Never start high-dose supplementation without medical guidance if you have underlying health conditions or take other medications, as proper diagnosis matters before beginning treatment. If this information helped you understand vitamin B12's importance, hit the like button. It helps us reach others who need this information. Comment below and let us know, are you getting enough B12 in your diet, or have you been diagnosed with deficiency? What symptoms led you to get tested? Your experience might help someone else recognize their own deficiency. Subscribe and turn on notifications for more evidence-based health information. No hype, just research and practical guidance you can use. Thank you for watching. If you're at risk for B12 deficiency, talk to your doctor about testing. Stay healthy, stay informed, and God bless.